For years, the standard playbook for American pediatrics included universally recommending roughly 17 to 18 different vaccines for children. Compared to peer nations across the globe, the U.S. Centers for Disease Control maintained the highest volume of recommended immunizations. To understand how that landscape is shifting, we're partnering today with Shasta Unfiltered, a platform dedicated to serving the North State with honest news and entertainment. On August 10th, President Donald Trump signed an executive order establishing what his administration titles the Gold Standard Childhood Vaccine Recommendations. This mandate targets three specific mechanics of public health policy. It seeks to drastically reduce the number of routinely recommended shots, space out the time frame for when they are administered, and fortify both religious and medical exemptions for parents. By intervening at the executive level, the White House is dismantling the centralized, high-volume immunization schedule and replacing it with a decentralized framework, one that is already setting the stage for legal battles across the country. This chart shows the raw numerical shift at the core of the policy. The universally recommended list of vaccines is dropping down from 18 targeted diseases to exactly 11. Instead of a single blanket recommendation, remaining immunizations are now sorted into a three-tier categorization system. Vaccines are divided into those universally recommended for all children, those reserved for high-risk populations, and a final tier designated for shared clinical decision-making between parents and doctors. This revised schedule brings the United States' total dosage counts much closer to the standard practices of other developed nations. The new target numbers intentionally mirror the immunization schedules of countries like Japan. The administration describes this reduction as a realignment with global public health averages, moving toward the lower dose counts seen in peer nations while maintaining access for families who choose them. Beyond the total number of shots, the order changes how those shots are delivered. The directive explicitly instructs doctors to space out childhood immunizations across separate medical visits, moving away from the practice of administering multiple injections concurrently. A specific target of this spacing directive is the combined measles, mumps, and rubella injection. The order recommends breaking this combination vaccine into three separate single disease products as soon as they become available from domestic manufacturers. These physical logistical shifts closely mirror earlier federal efforts spearheaded by Health and Human Services Secretary Robert F. Kennedy, Jr., who faced federal court challenges earlier this year when attempting to revise the CDC schedule. By reducing the sheer volume of vaccines administered in a single pediatric appointment, the administration argues they are ultimately giving parents vital flexibility and greater authority over the timing of their child's medical care. To enforce these new standards, the order directs the Attorney General to pursue legal action against states with laws that restrict parental authority, specifically targeting limits on medical and religious exemptions. This creates an immediate point of friction with states like California. Currently, California state law provides 0 religious exemptions for vaccines required to enter either public or private schools. The executive branch is using its financial leverage to force compliance, instructing federal departments to ensure that all localities, grantees, and contractors honor these exemption protections if they want to maintain their federal funding. This sets up a severe jurisdictional conflict. The order pits a federal interpretation of constitutional religious freedom directly against state-mandated public health requirements. Medical organizations are already pushing back. The American Academy of Pediatrics argues that combination vaccines are safe and effective, and that spacing them out across multiple appointments increases the risk that children will miss necessary doses. This graph illustrates the administration's primary counter-rationale, plotting the upward trajectory of autism rates in the United States. They point to data showing that approximately 1 in 31 children, or 3.2%, have now been identified with autism spectrum disorder. It is important to clarify the strict limits of this executive action. No vaccines are being banned. All current options remain fully accessible to parents, and for now, individual states retain primary legal authority over their school entry requirements. Locally, health departments and pediatricians across the North State are currently reviewing these new federal guidelines to figure out exactly how to proceed as the fall immunization season approaches. While the federal government has issued these new directives, the final impact on schools and families will be determined by the legal standoff between the DOJ and state governments. To keep up with how these policies affect your local community, Hit the subscribe button below and visit Shasta Unfiltered to support independent regional news.